Talo se sora malungil kapasangay ngil tutaw ngil odosong an moraro kulad mluek ketel bululad sola tegin sel time guk lamel boda sispra updates ra COVID-19 mangaringar gestergidel bo introduce tira edol ma direct detail makti mortegi de sola ngwa alia holbak arkida 488-4848 sida holbak number sola kulturge kumamay kulngum sa either written ma uben edol me belum ura program gidiral ko singay okay na ko la ne edon
okay kamal masawle tuli ka kamal masawlar adara dias broadcasting ma eco paradise marugul atal tira obang gidiral kasus kadamo mulra talk show gid mang mamong arite incident commander gid del maskida gel cook updates usual updates ra response tulig yang ngarinya terul toktang al ngartiang mastir ka ako ka part trustee kom remember last week yung laring isel ko trustee mlera talk sure gide tira ko PSLA so to ko mlera replace sel first team mlera nga sir gide tel lurere del respond del mora COVID tira terul toktang tartira Dr. Cecily Wang kang toktang al ngara hawal May mangaringya Dr. Merle Hillman nga ngarami ni Sotal May tira nga tokta nga tira trauma surgeon intensivist tel akor omese tuli ka tirgal ko ramal hido ya raktir mal ubeng ang tel medical situation astir so tira nga sang tamong ya cell temi reto din mutel ko kora maskida ko maka el background astir may gel ko ka experience astir ba observations astir el alngarbelaw
what say
malwaise kada mamorarite
okay
William Singet tulik. Oo, yagi dira kaldew mas masumong ka mo dakal sal tira nga rami kung paglimal ko.
Oh, di ako clear.
Okay, malungin.
Okay.
So, elang dito ko radi ma-update ra LLC test. So, ang LLC sa gidra halas report sergi del pilo gasera Friday. So, awriw lara ong diam sera Friday ra 3:30 PM. Afternoon el may LLC ra 3:30 PM. Ngaria 432 test el bleda conduct 42 COVID test so ayagi del 432 test el milga smokelers ayagi del el COVID testing center ma ER ma ayagi del community center community health center and 23 lebes el positive cases
okay
so 23 Mangsel dungura ya ko kumle recovered tirigel la mongi lang 45 ngaya 45 buk la clear isolation malupit na mongi ra COVID masel waise ko mesa arangalela recovered am la mo 3600 story
okay
segi del buk cumulative malupit ngel arangalela gay sergi del mail al sils am la mo 3922
I see
balgula sel the do mesra gel dong ko laseng active malubel tirgel dirgasmer 292 so 292 active cases as of today se mo serbo domre karatok sure gidia abol maumuot sa bidi sa gidel el book update tra cases
okay
Ada direct luluay sa laseng lariya omra el mora Southwest Islands rar ada dal mlombrus marmlo o test
okay
Mr. Albong yang los ariral marusra Helen Reef Coral Art Toby at 22 la Pulwana 22 Mason Sorola 18 marang alila ura 66 al adra Southwest Islands amno sa baril marus laring yar pustos o masim del tiram le boosters o palmosir Tirga rogul al test Raigel Belu timle negative mang el alta men sa vedas mulwa sen dia ka arak tra Southwest Islands alu bendir ka atal musmer al positive al ngara Southwest Islands
I see
ma dire kalmal al mga tulira hara ma olengi takla ni sir wa sir mo kom korak plan na umra el Raigel Belu edi bo tagarikla umila Abre mga test, make sure malakam sel, musel obo, yung practice ay agad preventive measures, mo mas kailangan po umgedra adra bulu.
What say?
Tidak kalngarnya umaral mel al trip perel al week al mura angaya ura Wednesday mamurang ayang alara Friday. Tosel trip peregi del mura angaya ura el al Wednesday amo merus aradal mo kadira kal mo sabed al mutal test mlania umaral sira Friday ngania stokta arnur sel mura angaya ura el mo test. And then el muta omra Wednesday el mo el mo o test and then provide orus yehidel del merusra first dose mar second dose malube kada mastrira boosters.
Okay.
Agure lo bangela akapar norma kabal metra ngaya urel mo o sabel ngari sehidel omra el almil Wednesday. Ako ka Friday and direk kal ngari omra el murang ayang ala ngari tigel Midrus so kadam lorang ayang alal dide ka manganyar pending ongirul daw serti mangmunganya umara alal mura ang ayang alal Friday lem lamot se mirul ukmalar se hidel second dose.
I see.
Adi daw sperte hidel se alle to maklas kastil go hidel mirus rang ayang alal wasay Friday nganya umara lehong ito mumrus.
I see.
Elang ang dia ka ya hidel 0.50 wal 6 mosmer ra COVID ngaring yawan al newing al ngamlen newing al kukngot al raktel ul enting positive ra COVID malul mangara isolation ra hospital.
I see.
Hindi sa dalo isol wase akluku eng dia ka ngaring open testing ra sele community testing center lo mura istori resulta olmo 11 dori alin di hafte ra kluku en diesel C4 close mangdia ar soktang hindi nganya testing magidira kalmal lo literara del wasal tumumpo mo o ngania ko ra symptoms sa kami usom test mo takangal me la mo nilal mo o afternoon al mo o ultitra mura ER afternoon.
I see.
Birakal Wednesday, kuay salwaseng blogoel dia mal adal mira testing, raway sa yidel wabal ngilawig, mang kada mo close ra sel Wednesday, mang mo dia ka testing ra Wednesday, dia ka yagidel C4, malumin dia ka set clinic ra COVID ra Wednesday.
Okay.
Mo el alwig ya Wednesday sa kada close. Hindi ka direct lo ay salwase al suma ada mal smer en dia ka Robertin mal sabarir el mera ER mas sabarir el mera OPD en open ra Wednesday hindi liya OPD close ra klugo kal Tuesday leng holiday.
Oh, okay.
O kada observer ra holiday ra klugo ra OPD man close sa OPD ra klugo en di testing seguida testing ang ari sel tutaw right tori almo 11 dori kadamdingil wasing bato ka activities sel maral makadira kaldio maklat ketuli sel domes ra beluar ada kuram lamu terkakla bato ka ay gayil kor ondi bela et sokora bato ka ondi bela et tamong etial sal kora observe ay gayil preventive measures sel blatol koy kadamdingil wasya agay samla maral meryo hindi kita telo mesel wase maral meryo hindi bir kangaringi yakal blal bola kal completely limpia akadaw takangal wase tidaw takangal mutal di practice ay kal preventive measures to ko ni especially sum ka kokoramal asiro kal smer ela kabum tolerarat la kapurase kata ma even though yakamla talbom ser please edim molmol mel practice of preventive measures lenya ka do tingay sumang kadam tingay wasaya sum ka mlatalom sera tara variant sa emal mosmera tara variant nya albul kula wasay kamla mosmer mal tikyam lutel mosmer virakal dogi utay de do ay sa say kumkwari mbala sa kadam lesenda ay gale specimen ergi del mura CDC mo sequence ang 14 al specimen able descend En din kawan na bladong wa result ringim la mo sabi del mesar al sela system. Lo sabi del mesar el al sil sel wasay one at least one raigel be the del specimen el mo Omicron el segi del sublineage el BA 1.1.
Okay.
Yeah, so segi de gida dir kami raigel sequencing raigel mutel dortin.
Okay, delta dirga hal main din digital Omicron.
So, come remember last year, I get first two cases last year August, amle Delta.
Oh, okay.
Yeah, so we had Delta last year in August, at least in August, I get the first two cases.
Okay.
And then I get the gamle January.
Oh.
So December January. So those cases that we sent off, at least one, bladong sequencing ringil Omicron BA 1.1.
Mela kardi mingir AB.2.
BA point na yakataplo.
Dia kung dito nga lang nungu malakal may.
What say? And then give it a close wase. Namos yaka maladal mira umrus. Terat offer flu shot and direct kalbim le dori favar adal me. O man nom pasar adal me kalbil na urus. Mela weekend yaka umrus yaka pas. Direct kaldigia pas yorgid kadam dagel wasta kaduradi mat mokler gid el girela ocean sa may gal venue sergida kura dongot mokler girel tel klolon bibla. Mang elal weekend en lamong at ay gidele vaccination. Ting agi momruler ngil wa tirgel every week at tirgel mlamay for so sel giril memla second dose agi bomom godong artira schedule time at memrus.
Okay.
Tira kal kumarada soril mala booster tir agi dolingit el wase memom godong hotline say gidel 4880555. So milom godong hotline kada scheduler kami we ko me emrus. PLL Friday already got the schedule PLL Friday for the oril mo 6 stories. The community health center across the horror. So he did for the 2 6 stories. Yeah, ada sa el walk in el momlara booster ni and din dakal ngaring tirgel second dose and tipo mo ko still remind the still mat sa momlara second dose Friday.
I see. Nga Akmilora Airport ra nga rawan 12:30 ra kasus load siwek le merato kay lan molgoy ndia ko dengel wasarado mesa el disela agil positive la maran medio but automatically feel or think that it's safe enough pel ngutial mask mo roid lesel tirgem la airport ko mesa tire ndikli bikra vital dingala ade tial ngrela open actually se hoy etia Yagim lang masyat. Mang last year mga the reminder adol sa oy kum lang masyat ni seven mosmer and dito message seguidly this year other elad positive el declining. Oh, metar automatically till diagnose tel abdangir embergo mega decision as namo safe enough for tung tel el mask again the answer as no. It's still not safe enough. Why say yeah?
Why say oy. Dia kalbel gula wasang maran medio manglamod ya. Pagdirak kal uldio nitra di Bulgaria lang. Jadi tak lakare. Dia kalsar al mal di amoy tay jangal. Al bol ulang ko ka mutel moania au rice rake sa sergir.
Why say?
So tuliran din na gayid ya update nga.
Gamlu to do resell tela la positive reported el positive tela.
So el alsil sa number positive at 23 pitrigel PS el mlo modang al positive.
Auto kia rogun tela sa total.
So accumulative tirigel rogun mla mosmera 3,922. Tirigel mla recover the 3,630 ma active cases el alta ma 292
la medio
so tirgal 292 adir ka sabari loy wali mora tara tirgal al bolser why say matirgay del 23 el bes el mildang el alsils asabari ra contact certir el klugo nya se tamo positive. So So, gira dal dir ka careful and kal bulgula wasing maral morio makadamo.
Okay. Insa dang utial golon ngar ngiwal?
Makabong.
Okay. Kabo yung iwal?
Baluil kasi nakakatuloy.
Ngil ka pa siya?
Pero IC ba, PIO? Igat to sa lahat siya.
Amo ka na?
Ngil ka siya, Bortis.
Oo, ngil ka pa siya. Kalmit question na ka.
Tiyagis. Kailangan ko na sila, masala, full dose ba? Pero hindi na nga full dose. Kailangan ko na magkatest mo na. Pati yung elwasi. Ako nga full dose, wala ko na nga boosted. Eh, di ako na kasi ang ako ba diya ka bulgul da test at ginagawa di ba wala na test at yung para service.
Kamla usap question na dito?
Ngwase ang sayadan mo nga test at sumdi so dal chikargid.
Oo.
Ngwase yung mal sukum ka even though yakam lakadan nam siglo say even though yakam lamrusel namay gal required daw sa kaw im lang booster kaw still in sab ml mosmer tehidal especially tehidal omicron mang sab ml mosmer ngi men sab ml mo test di ka lo mal asir ka wal sum ko ram lam mo ngi gidal symptoms di blood o sad im dang al qal was kam lo tro ra adal di kam moding star still was til gat smer ndi al ser mal ube kam le tlo ra adal di kam mask dim la kam gargikle en kanya te LML mos merong mal sab ML test.
Oh, okay.
Okay?
Ada ibo actually.
Apo?
Kaya ibo. Kaya update terwin.
Update?
Tilo na last week, baru tweet ago.
Oy.
Tagadi up to Roswell. Blawi kabe. Tilo ko tabla ya sebe la chit tiga gitu blawi kabe. Al diga atal la orus. Agar bodo albe ako kogel wasi. At awat tiga yun, di blanc la orus. Le sel 2 veces. Trae allí la orus se bosper. Allí la orus se más. Allí blanc la orus se más. Ojalá Dios lo así. El awat tiga yun la orus bosper en bla rigabes. Tiga tagara di blanc graf se azakta ukpal di blanc bolsel se tiga de la. El más algo estresa.
Kam nga dak MD ka kabong.
Waste o pai raw ngil ilagi dal abay ko raw ngil sekwe malubeng raw ngil te ale da transfer nya al mortirgal MV atuli.
Okay, sabo.
Ya kabo ela kabel ko tora mligel mas. Ali timlahe ka. Okay. Ela se question ngir lang har bititirgel MD mboro sauder ni.
Okay.
Tuli ka bere halle the borstir melgora small start المسابة maybe تمول answer a question ra ngaruba karang iwal. Tigim la lusi a question mal sugu mende al boldali. Yagi geogeretit.
Tilagi.
Bolva ise. Mada Dr. Hillman and Dr. Wang. So maybe one of you can start off.
Sure.
Okay.
My name is Dr. Moreau Hillman. I'm an emergency physician in St. Paul, Minnesota United Hospital. I am the team commander of the Minnesota Disaster Medical Assistance Team, which is part of the United States Health and Human Services. We are 14 personnel here in Palau, including Dr. Wang, a PA, 3 RNs, 2 medics, a respiratory therapist, logistic personnel, and administrative personnel. Our mission here is to support the Palau National Hospital during COVID surge. 6 weeks ago, the numbers in Palau were very, very worrisome, and it was felt that the hospital needed to have additional support in terms of personnel that would help run a COVID unit and to decompress the emergency department if it became very crowded. Fortunately, the first group that was here dealt with the surge, and the numbers have gotten much better. So our job now, in the absence of a surge, is to prepare the staff to better treat COVID if a surge comes in the future. In Minnesota, we experienced COVID surges in October of 2020, and then in November of 21 with the Delta variant, and most recently in January and early February of 2022 with the Omicron. The Omicron variant is very contagious, and although less serious illness than the Delta, many of our staff became ill, and there were staff shortages resulting in emergency department overcrowding, bed shortages, and stress to the healthcare system in general. Over the past 2 years, we have learned many lessons on how to care for these COVID patients and have more tools to lessen the effect of COVID, including vaccinations, monoclonal antibody infusions, and antiviral medication, which prevent hospitalizations and hopefully prevent death. Fortunately, you have done a fantastic job in vaccinating your population with a vaccination rate that's 97-98%, and I encourage everybody who hasn't had their second vaccination to get a second vaccination, and anybody who's been 5 months since their last vaccination to get a booster, because in Minnesota we found that really helped. We have learned best practices in hospitalized COVID patients, which we hope to share with the medical staff here so they can better deal with the COVID surge that we hope doesn't come.
So maybe I can ask the first question that came in, since you mentioned that vaccination and boosters, including boosters, being up to date with your vaccines is very critical in its role in preventing severe COVID and death. So this person says,
COVID. No, not. Okay.
So this person says, I took 3 doses, so that's first, second, and third dose. So this is an immunocompromised individual, but they tested positive and recovered in the last. Well, she wasn't specific. Do I still need to get the booster shot? That's the question.
They had
two
vaccinations or 3?
3. Third dose. So this person is immunocompromised, so they required a third dose instead of a booster. But then they tested positive and recovered. Do they still need to get the booster shot if it's their time to get the booster shot?
Was this person's third dose considered the booster?
No, third dose.
Third dose.
Got the third dose, so the full dose.
Well, first of all, I just want to say that we had hoped that the vaccine would prevent anybody from getting sick with COVID. Unfortunately, that hasn't been the case, but it has prevented many people who catch COVID from getting very sick and requiring hospitalization or dying. So, although it's unfortunate that this person, that you had COVID, it's fortunate that you recovered and hopefully didn't require hospitalization. Immunocompromised patients are kind of a special case. Do you want to?
This is Cecily Wang. I'm an ICU doctor from Honolulu, and I say when it's time for the booster, everybody should take the booster, and it's especially important for immunocompromised people.
Yeah, so I guess the general guidance from CDC is that if they got their third dose and then 5 months later they can get a booster. So say give the tuliga and settle more question. I was say even though you've got COVID, you've recovered, but 5 months out of your booster, I mean your third dose, then you can get a booster.
Yeah.
Okay, but if I wanted, I got 3 shots, Pfizer or Moderna. If I got complete my shot, 3 shots, right? But I just want to make sure that I'm not going to catch this disease. So I go and ask for booster. Would they give me a booster? And if I get the booster, am I going to be much safer than the other people that only got 3 shots?
The question is, can you get a booster on top of a booster? So that's different than a third dose.
Yeah. What I'm saying, you got 3 Moderna, for example, right? But I said, well, if I go and get a booster, I'm probably going to be, my health going to be much safer. Okay, so can I do that?
Tuloy, So let me just answer, as other Belawe, so the Palawan context. If you come to a pod and we have your vaccination records and it shows that you got your booster.
Okay.
It's you a booster yet, because the guidance is very clear from CDC that
right. Okay.
Not a booster, you're not up for a booster yet.
Okay. So what are you saying is that when you come in, they look at your shot records or card.
Yes.
And if you got it, then they're going to tell you they're not going to give it to you.
Yes.
I say it.
Yes, that is correct.
So this is Dr. Wang. That answer is correct, and if the person is asking whether, if somehow, if they're able to get it, is it going to help them? And the answer is no, because it's already in your system. And if you're within the time range and you got your booster less than 5 months ago, getting another shot is not going to make you super protected.
Yeah. Okay. We all make a mistake, Dr. Wang. We all make a mistake sometimes. Like, for example, if somebody made a mistake, I already got 3 shots, and then they give me the 4th one by mistake, am I going to die, or I'm going to suffer, or what?
No, but you're probably not going to get any benefit.
I see.
The fact that you had COVID after the booster means that you had even more immunity than before. So it's not necessary.
Okay. Well taken. All right. Okay, let's continue.
So Dr. Wang, can you?
Yeah. Okay. So I'm Cecily Wang. I'm an ICU doctor and I'm a surgeon. I live in Honolulu, Hawaii. And I was here with the trauma critical care team in March 2021. And what myself and my team noticed was that, well, the first thing we noticed when we came here was no masks, because there was no COVID here yet when we were here a year ago. And what was so awesome about that is, well, last year we could say we felt Palau was a year ahead of us. And now you're almost 2 years ahead of us, maybe not quite exactly 2 years. And how I count is we've all been in this pandemic together for over 2 years. We've been globally experiencing this pandemic together, but what I'm counting is when the first cases started, or the first surge started. And so back in the US, it was March 2020. And in Hawaii is March 2020 when we first started seeing COVID patients. I was out on a mission with MHHS in California. I came home in late March, and we had not even a real surge. We had several patients in the ICU, and everybody was scared. Back then, we had no vaccinations. We really didn't know much about COVID. We were first, we were intubating patients. So I can speak mostly about ICU patients because I work in the ICU. And just because I'm talking about these super sick ICU patients, that's a very, very small percentage of COVID patients. It's just the patients I see. My friends in outpatient see the people who are, being treated as an outpatient or who are isolating at home. But 2 years ago, we were learning everything we can, and the people in Palau were learning from watching everybody else, watching what we were doing right, and mostly watching what we were doing wrong. For example, we were at first intubating people too late, and we found that, well, by the time we intubate people, they were already so tired and so worn out that it wasn't going to be much help. Then we were intubating people very early. There was a while where we said, when the patient reaches 6 liters nasal cannula, we should think about intubating. And we were doing that. And then we finally found that it's really somewhere in between. And the docs here at BNH and the nurses, they know that from talking to the colleagues from outside. So this is what I mean by healthcare system here and the EOC here and the MOH here are 2 years ahead of us, of the rest of the world. I think it's really like impressive that the vaccination rate is somewhere around 97%. And then COVID came. So what I'm saying is we're here not because nobody here is in trouble. We're here to kind of because we have experience managing COVID patients in our hospitals, and it's probably helpful to like tap onto our experience.
Okay, Dr. Wang, can we entertain this call just came in?
Sure.
Okay.
I can take it.
Gabo ngat mau.
Ya malu saya komene pal korang doreng sembo klo ulum momreng mo yak reng.
Oi.
Di sel agari kawasi ka mamel old age mle hotel mla oru mlambo hotel siata gimara madre na gidir ke gomala booster.
Okay. Kami se rite.
Oh, so al tugum kangilu first second selong ederga al tugum magnuklo se third dose and then in sa emel menwa booster ga al tugum lamo 5 months after the third dose and dil tugum kangilu booster selong edel lorusa booster en dirga bo mo spera al mutel booster.
Oh. Dia kan jimla ki mo booster aki dingira dur dosra madernara mam pigel 7 ogi madernira mam
palsugum kangilu dur dose emla mo 5 months en sab emel menwa booster raw
melaki to amal kol hotline melka schedule
ay se kom di kol hotline o gore rula appointment sa kami me malari.
Okay ko mal masaule.
Okay, meiga.
I think it's very confusing for a lot of people in the world, in the U.S. and maybe here, that, well, we're so well vaccinated, why are we still getting COVID and why are we needing boosters again and again? Well, it's because the virus has been mutating. So when we first made the vaccines are supposed to keep us from getting COVID altogether. When we first made the vaccine, it was very highly protective against the strains of COVID that were there when we made the vaccine. And unfortunately, it kept mutating around the world, and now we have this strain, Omicron, where the vaccine offers protection, but it does not prevent us as much as doesn't prevent us from getting it as much as it did with the Delta variant. So this causes a lot of confusion. It caused a lot of confusion in the States, and maybe it causes some confusion here. And also, why do I have to get boosters? Well, we're finding that, like we get flu vaccine every year, we're having to get the COVID vaccine after 5 months. And in the future, I don't know, it may be once a year, it may be twice a year, I don't know yet. It's going to be based on CDC recommendations and based on future COVID variants. I don't know if that answers the question at all, but I know there were a lot of questions about the vaccine and boosters.
Ndaya tuli kambing sabele gitim kora osi isel piginya la kal tokta mal dir ka swata lu tel botol adar belau el dir ka giril memala booster tis belanga ya booster tis lengal tokta ngamal kol masay ar adal amos esel garangri remo o gerek masay ngara ul magi di malaigal yopo igal lorus mang sera kotlo mo lel kat maklitel vaccine ra covid en mle ungileleng ang guk morsel mle qotal covid sel qotal armela covid system lamo mqater tamang mla chance mutate tamang igal vaccine sa qora lamo triple mi utel degal prevent ra aser tindir ka sab ello nga se will prevent kukora mal mohido mal ube ka mata tel COVID di sa lol gornya kasi over time ang motel gibel nga riyo immunity ra or tegi del raft mang mal important ta obe mga booster sila kami so mamal kuk nga public health mal mga lera rogul adra buluk masay selbla sugu momlamot teme memela booster sel gim open ebe mu yal sugu mendirga ge mom kodong ra hotline em schedule teme men hotel booster lendir ka beto kan adal ngara sela blul dirga al giril mela booster tin din dirga kalmu
ngai say Tesel lo missing in the way a case rase o a seat belt I say wear your seat belt ndi al karentil wa say o mo seat belt ndi a homa ndi sebel ngo sugawa in case if you run to an emergency right so in other words it's working like a seat belt you know
yes it's a layer of protection like a seat belt
yeah but it doesn't guarantee you that you're not going to die when you have an accident. Correct. It's just going to help you to minimize the possibility of getting killed out there.
Yeah, and if you have a seat belt and you also have an airbag, you also drive under the speed limit, and that's 3 layers of protection.
That's right. Yeah. Okay, let's continue on.
Did you have anything else? There's another question that came in, maybe while we're talking about vaccines and protection and all of that. So this was the question from Yuval, I think. He was asking, we have these people we have a fully vaccinated community, people are vaccinated, but then we have some people or a lot of people who recover from COVID, they have mild symptoms, but then we have people who are vaccinated but got severe COVID or died. So maybe you can just talk about some of the, like, why do we see that variance? While some recover, others get severely ill and die, including those who are fully vaccinated.
We'll go ahead and get started on that. Certainly the vaccination helps lessen the severity of the COVID, but people who are vaccinated sometimes do get very sick, sometimes need to be hospitalized, and sometimes even die, but a lot less than those people who did not get vaccinated. Usually the people who get very sick with COVID, despite having the vaccinations, are people who have underlying medical conditions, especially diabetes, especially heart disease, cancer, they're immunosuppressed, those are very overweight. Those are all risk factors that make it more likely that if you get COVID, you're going to get sicker, but the vaccinations will help make that risk less. So I think that's the seatbelt that you need to wear.
I agree.
Yeah.
Yeah, it's the people who it's not anything the people did wrong. People who are fully vaccinated and still get very sick are, like Dr. Hillman said, people with other medical conditions. There are young, healthy people who end up getting very, very sick, and we're still not sure why. Maybe some of it is genetics, and maybe some of it is luck of the draw. We do see that, but very, very rarely.
Okay.
You know, we have to look at other perspectives. Like, if you're not fully active, if you're kind of just lay back, eat, sleep, and play, don't have no exercise, you're not a healthy person. More likely, you know, you're going to catch this. And when you do catch it, you know, more likely you're going to probably die. Because, you know, if you're healthy and you participate this exercise and be active, you know, I feel like, you know, that also will help you not to get the COVID-19.
Yeah, exactly. You bring up a good point. Some of it is maybe someone who's seemingly a very healthy person but has a very high stress level.
Right.
Also brings down immunity, or maybe no longer exercising.
Right.
I stopped exercising when COVID started. And maybe drinking a lot more than before.
Right.
Maybe smoking a lot more than before. But they just seem healthy.
Right.
I think also it's very important that when people first develop some symptoms, that they don't ignore those symptoms, that they get tested, and if they're tested and they test positive and they have a lot of other risk factors, there are medicines that they can take that will prevent them or lessen the chances of them getting sick enough to be hospitalized and dying.
Yeah, but that being said, I'm not saying that there's no healthy people can get. I've seen seemingly very healthy people get sick, but very rarely.
Why say tuli mang ngel ruba kada ang niwalay hoping din ng single doktangal masay why say ngarnyar adal mla may kalorus ending sabirin malmos me ere malubet tamas yari ter sera losa da sige yidel kukka mladra balwat kadam lo matikari masay oy ngarnyar stead of stiril nin lang maya or serir hindi tira ka nga mal ko rama wadale ngarnya ko rak malo bradal raktit yidel ko ida yung raktela heart sa malubeng sukal malubeng sawa tirro uyel mlama ta say yidel ida tamal mawad malubeng ngarnya ko ramal klol raktira ul man direct contribute del mura ako del lead.
I see. And also I'm strongly believe that if we we eat our own diet, own food, if we eat our own food, because our system, I think for some reason they're expecting us to eat taro and fish, food that we have been eating for many years. Yeah. But nowadays we change to eat American food, the Japanese food, other food, and for some reason our body are not responding, to those kind of food that is kind of foreign food, which is not providing, protection for our system, So I think if I eat my Palawan food 90% of the time. I eat Palawan food when they are available. But if we all eat our own food, Palawan food like taro, fresh food with no additives and no preservative, because when you import food to anywhere, especially when I was in the military, we import food to feed the military out there, and come to realize they also use a preservative to preserve the food so it doesn't spoil. At the same time, they put additives, which is not good for you, and that screw up your system. I hope I'm wrong.
What we put in our body is very important. So what the food we put is very important.
Right.
I agree.
Oh, one other thing is, I've seen some healthy, what we think, people we see healthy doctors and nurses get very, very sick from COVID, and because I work around them, and my theory is they're so tired from so much work that actually makes their immune system lower.
Okay, can we get this call from Iwal? It's the same guy that wanted to have so many questions. Kabo nga rin lalo. Oh, ikaw.
Ako nga kasi. Lang sumer suba. Reaksi sa tama ba ikil pa doktor pre.
Oy.
Sumer ba bring la pa ke di bokla ra orus.
Mer orus ra ra.
Kaya ke bus ayagir basta ayagir orus ra COVID.
Kamle accident mang bring oil lang kamle accident.
Ay bus bring. Di ra po orus sumer ba orus.
Kung nause edol. Okay, can summarize ringi gulas mo summarize.
The question is, he's using a scenario.
It's the same guy.
It's the same guy. If he was recently in an accident, so his leg really hurts, he's in pain, should he just go ahead and get the COVID vaccine?
Is it safe for him to take the shot?
Yes.
I agree.
Oy, sira kita mula sing maldir ka sa suku mong sa el ko tukur tiar ring level o la ring dia ka ngaral tomalir al sabat ngel.
Di sel orus dia kal fix tial mring rab ngel sek asum klita el ngok malara imor orus dia tial covid Moderna malu Pfizer a fix tial mring lo ira ko mo confuse lang mle accident mring lo ira mergo mo malar tial orus ngan ta question niya se mang help pertiang al oben ngarial tamli asum tialo iga mring mle accident if mo orus seng sebet tomla al oben dia problem Dito ako na sa tinasira sa hindi problem, go ahead and take the shot. What I say?
Ngoy say hindi ka matamal.
Okay, that fellow right there is, we work together. We have our own television and radio show, and a lot of people are calling him and have him ask the questions on their behalf.
Okay.
Yeah, that's why, we hear his voice every now and then, okay? Okay, Kadolmod, we got 10 more minutes, ladies and gentlemen.
So maybe you guys can just share a little bit about, or maybe if you have any recommendations for moving forward, seeing how we are right now and what you've experienced in the States, what would you say?
What's your advice to us, Palawans? Are we doing okay with our programs? Are we, complying with the CDC requirements and all the preventive measures? Are we doing okay?
Yes, you are. We're very impressed with your guidelines for protecting your country, and when we come in, and the restrictions of movement and the mask wearing is pretty universal. Vaccination rate is very good, and I think that's why you're not seeing the spikes that some of the other places are seeing, and I hope it will continue.
Right.
Yeah, I agree. I was here last year and this year, and both years, I from what I see, Palau is relatively prepared compared with many other places.
I see.
And what I think helps is the people are vaccinated now, and the hospital staff, the Palau National Hospital staff, the doctors and the nurses are highly skilled and also very caring, because their patients are their community, their family, their cousins, their uncles. So I see how they treat their patients like family, which is helpful.
Yeah. Our frontliners are working very hard. We've been doing this over 2 years now, especially Edom and Rita. We've been working together and disseminating information to the public. And I strongly believe that strong media here in Palau what helps a lot, because like when they want to educate or remind the public do's and don't, right away, all the media comes together. Just like tonight, the government-owned radio station and my radio station, we together and broadcast its updates to the people, so they are well informed. And I strongly believe that media is doing their job right.
In addition, I just a word of caution. I also think that the Palauan people are stoic people. They don't complain too often, and they come in maybe after they get really, really sick. And I think this is one condition where catching it early and treating it early can really make a difference between getting so sick that you need to be in the hospital or just being able to handle it at home. So if somebody has a sore throat or a runny nose, they shouldn't just ignore those symptoms. They should come in and get tested. And COVID can present just like an ordinary cold, and you don't know that you have COVID until you get tested. You don't have COVID until you've been tested, so that's important.
Going back a minute, I agree, the dissemination of information is vital. So the media putting out regular information sessions and transparency from the leadership, all of that makes a huge difference.
Right. Okay, Edom, you heard that?
Yes.
Do you agree or disagree?
I agree.
Yeah, because the media here in Palau is very strong, and I mean, don't do anything wrong, because the minute they hear about it, it's going to be all over the world. Yeah, so I think we're doing job. Are we doing a good job, Edol?
Pero tira kita ko amat tara other bela mang matala ko first tire tulik.
Okay.
But you doctors mentioned something that feedback from the community. So some people we can even say a significant number of people, they won't get tested. They would just stay at home and not get tested even with symptoms. So why, can you maybe elaborate on why it's important that, you know, if they're symptomatic to get tested? Some even say, oh, never mind, this is just a common cold, this is just like the flu. So maybe you can elaborate a little bit on why that's important.
For two main reasons. It's important to get tested early if you have symptoms. One is that if you do have COVID, especially the Omicron variant that seems to be here, it's very, very contagious.
Okay.
It's as contagious as measles. And you might be spreading it to the people that you care about most.
Yes.
And you don't want to do that. If you have it, you want to be able to isolate yourself and to just isolate yourself for 5 days, you know, or maybe at the most 10 days, and then prevent your loved ones and your neighbors from getting sick. Once it starts in the community, it's like wildfire. It spreads very quickly. The second reason to get tested early is that we have medicines now that we didn't have before. The antiviral medications or the monoclonal antibodies, depending upon what your risk factors are, that can really prevent this disease from progressing in many cases. Not all cases, but in many cases, this will lessen the effects of COVID and prevent hospitalization and death.
Okay, Dr. Hillman, can we get this last call?
Sure.
Okay, Ali Gabong ang iwal?
Ay, sulakit tuligit. Kaya ba, jalas ka gol blay?
Ay.
Kalau mo gol blay pasti. Tilal ko tu pesa tok na ko jogal pasti. Kaya yung BA2, kaya yung BA.2. Blank ko bla ko.
Ay.
Ele na tu me dio ko por velo. Eso ela ya ir 1 2 3 12 bla right?
Protector kami, ay gagi del plam ngayon Moderna, may gagi del Pfizer, may Johnson & Johnson, and sapel, ngosu kami wa sugum segi de sek diru asem BA.2. Oh. Tilang BA ng AB. Okay, here's the question with Dr. Hillman. Thank you, ang iwal. The shots that we have gotten, Moderna, 3 shots or 3 doses of Moderna and 3 doses of Pfizer and Johnson & Johnson, okay, if we're fully vaccinated, will that be able to protect us in case of that new variant comes to Palau? They call it BA.2.
We think it will.
Yeah, do you think it's going to help us?
I think he's asking the vaccine efficacy from the...
Yeah. So far, the studies show that the vaccines are effective both against BA.1, BA.1, and BA.2. We don't know as much about BA.2 because it hasn't been around that. We haven't identified it that much. It's too recent. But the early studies seem to say yes.
Yes, okay. Okay, thank you so much, Dr. Hillman.
Especially if you're boosted, right?
If you're boosted, right.
Yeah.
Especially if you have Johnson & Johnson, make sure you get a booster with the Moderna or the Pfizer.
Yeah. Yeah, I got my shot. I'm Johnson & Johnson, and then I went in and got my booster, and I'm okay. I never had no headaches, no backache, no nothing. No symptoms whatsoever.
Hope it stays that way.
Yeah, so I'm lucky. Okay, so gentlemen, ladies, we have come to an end of our program, so I'm going to give the line back to Rite or Edom, and then you guys say a few words and say goodbye to our guests and also our listeners, and until next week, Monday.
There's another question, though, if that's okay.
That's okay.
So this person is, can you ask about reinfection, if they've seen it where they work, in Hawaii or Minnesota or elsewhere, and how long after you recover when you can get reinfected?
I've seen reinfection. Sometimes the reinfections that we think are reinfections might be the same COVID from the first time. Yeah.
Long COVID?
So say someone gets COVID in February and they feel a little better, but then they feel a little bit worse, and they get tested again in March. It might still be positive at the same time, so I don't consider that a reinfection. A reinfection is someone who tested positive, was sick, became well, tested negative, then maybe a few months later, or even half a year later or more, gets infected again. And I've seen that a few times in Hawaii. Less than a handful of times that I've seen it. And again, these are immunocompromised people that I've seen that.
I agree. There's the possibility that with new variants, it may start happening, but so far it really happens very often. It's rare.
Okay. Yeah. What we want to say is there's no cure for COVID. There are better and better treatment modalities. And these treatments work best earlier on. So when someone starts to get sick, which is why we keep emphasizing get tested early and start the treatment, recovery will be faster.
Okay.
Right. I'm gonna take a question to Tulip.
Okay.
And did you want to have a final comment before we end it? Anyone?
Yeah. I just want to say that it's been a pleasure working here. Your people are lovely, and it's so inspiring to see the willingness of everybody to get vaccinated and care for each other that it warms the heart.
Okay.
I agree. This is only my second time here, but it feels like home.
Thank you.
Okay. Thank you for your time, ladies and gentlemen, and we'll see you next time at home in Incident Commander Retail. Bye-bye you all. Ngarel belaw command besar abang ngarel belaw. Bye-bye.
Thank
you.
Bye.
Okay, bye.
Lakmal globo by the line bo me sabalwal mabli the